Hi there, I'm Teresa Dufour with today's CT Style Express. This year more than ever, it's important to get your flu shot. Mick Moldick joins us. He's the vaccine coordinator for the Connecticut Immunization Program, part of the Connecticut Department of Public Health. Mick, thank you so much for joining us. I'm assuming you're very busy these days.
Very busy, Teresa. Thanks for having me.
Sure. Thank you for making time for us. Today we're focusing on the flu shot. So why this year more than ever is it crucial that people get vaccinated?
Well, Teresa, I think what's important to remember this year more than ever is that with the second wave of COVID that we're seeing a lot of it, people in the hospital with COVID. We want to keep people out of the hospital from the flu. So the best way to protect people is for them to get their flu shot. Unfortunately, on average, in an average year, only about 50% of Americans get a flu shot. So we have a vaccine. We have a vaccine that's effective in keeping people healthy, in keeping people out of the hospital, in keeping people alive, but it's greatly underutilized. And so what we're trying to do on the state level and on a national level is to increase those numbers. And so we're really trying to stress this year more so than ever to get people vaccinated with a flu vaccine.
And who, Mick, is eligible for the flu shot?
So anyone 6 months of age and older is recommended to get an annual flu shot. We do a pretty good job of getting our children vaccinated, but unfortunately, adults 18 and older don't do such a good job. 65 and older do a really good job of getting an annual flu shot. It's that 19 to 64-year-old population that don't seem to get an annual flu shot. And whether that's because they don't feel the need to get one, or they don't think they're at risk, or they don't think the vaccine's effective, or a lot of times they'll say, well, I've never gotten the flu before, so I'm going to roll the dice and just keep on going along without getting a flu shot. They really can't afford to do that this year, more so than ever. And so we really want them to take the time. It's not too late. It's still the holiday season. We want them to go out, take the time, go out and get a flu shot now.
Sure. And I know that the Department of Public Health is taking on a new campaign, Fight Flu CT. What's the mission behind it? Obviously getting as many people vaccinated?
Right. So we're really looking to try and drive those numbers up. The number is about 50% every year. The preliminary numbers so far for this year are still only around 50%. So even though we had this campaign going for the last couple of months, we're still seeing those low numbers. So flu season runs all throughout the winter and into the spring. We still see cases throughout the spring, all the way into April and even sometimes into May. So we're not nearly at a peak for flu numbers. And so we really want people to take the time, if they're not sure where they can go, if their primary care physician doesn't have flu vaccine, they can go to vaccinefinder.org. They can punch in their zip code, and they can find a convenient location next to them that's either no cost or low cost for them to get a flu vaccine.
Wow, you take all the guesswork out of it then. That's pretty easy.
We try and make it easy for them to go and find a place where they can punch in their zip code and they can find a location within 5 miles or 10 miles, usually a local pharmacy, a grocery store pharmacy, or CVS or a Walgreens, place like that will have flu vaccine. There's plenty of supply that's still available right now for them.
Very good. And again, that website is vaccinefinder.org. Punch in your website. It's very easy. And still, now's a great time to get the flu shot, right? You didn't run out of time.
There's still plenty of time. Like we mentioned, we're not at the peak. We're not nearly at the peak. Usually the peak for flu season is January, February, sometimes even into March. We see cases even into April and May. And so people who don't have a flu shot yet, go out there, get it. You're not only doing it for yourself, you're doing it to protect your loved ones as well. And especially around the holiday season, around these winter months when we're spending so much time indoors, you're going to be spreading these germs. And so we have a vaccine out there. It's not greatly utilized. We want to drive those numbers up and protect people as much as we can.
Very good. Mick Moldick with the Department of Public Health. Thank you so much for all the advice and the encouragement to get people out there, get vaccinated, vaccinefinder.org. We appreciate your time.
Thank you, Teresa.
Sure.